old days, though she had young men's praise and old men's blame, among the poor, both old and young gave her praise. You called social services. It was you.
No. No. No.
It's okay, it's okay. I get it. He'll have an easier time dealing with the system. Sure, he won't be with his real mother, but his real mother's sick. Someone needs to take care of him.
I'm not gonna live here.
And what would his future have been? Taking you to chemo and back on the bus. And even if the cancer's in complete remission, you'll still have a mother who hears voices.
Talk no more. Talk no more.
Look what I do to him, Limpy. You said that. I checked the phone records. Only one call from this room. Smart. They charge you $2 a call. It was to social services, state of New Jersey. You're his mother. Couldn't do it to him anymore. Good for you.
Schizophrenics can make rational decisions.
On the small stuff, yeah. When to sleep, what to drink. You know, no lemonade, but I'll take some hemlock if you've got it.
Your man Socrates.
But giving up your son, because it's better for him, it's so sane, so rational. Self-sacrifice is not a symptom of schizophrenia. It excludes the diagnosis.
She's not schizophrenic?
Look, she's 36 years old when she first presents.
It's a little late, but within the parameters.
The internist sends it to a shrink. One shrink sends it to the next. She tells them all she's not crazy. The drugs don't work, and why would they if she's not a head case? She got clearer when I took her off the psych meds. You think I'm crazy?
Well, yeah, but that's not the problem. Didn't we just leave your office?
I like to walk.
Is that Dr. Jeffrey Walters?
Hi, my name is Greg House. I'm a doctor.
Oh, is that the time? I'm sorry, my watch must have stopped. Listen, you treated a patient about 18 months ago, a woman named Lucille Palmero. I wondered if you recalled running any tests at all.
Oh, how terribly foolish I've been, Doctor. Is it that late? Yes, I'm calling from London, you see. Must have got my times mixed up. So... I have a headache. It's my only symptom. I go to see 3 doctors. The neurologist tells me it's an aneurysm. The immunologist says I got hay fever. The intensivist can't be bothered, sends me to a shrink who tells me that I'm punishing myself because I want to sleep with my mommy.
Maybe you're just not getting enough sleep?
Pick your specialist, you pick your disease. If it's not schizophrenia, what else presents with psych symptoms?
Porphyria?
Madness of King George.
What about that copper thing? What's it called? It's genetic. The body accumulates too much copper.
Oh, Wilson's disease?
Yeah.
Very rare. Nice. I like it.
If any of us did this, you'd fire us.
Well, that's funny. I thought I encouraged you to question.
You're not questioning. You're hoping. You want it to be Wilson's. Boom, give her a couple of drugs. She's okay.
July 17, an appointment with a Dr. Karn.
She didn't keep it. She never kept another appointment with a shrink he made after that.
Karn is not a shrink. I looked him up. He's an ophthalmologist. Now, why would you want her eyes checked?
Wilson's presents with cataracts, I think.
Yes, it does. It also causes slight cirrhosis, which Dr. Chase so eagerly attributed to alcohol. So what are we still doing here?
Lucy! I don't think you're crazy.
Neither do I. But I'm crazy.
Come on, here, you get here. Come on.
Just put your hands on the bar here and your chin in here. Thank you.
You're gonna see a bright light, okay? Your body might be accumulating too much copper. If it is, this should help us see something called Kaiser-Fleischer rings. Copper-colored circles around your corneas. Wow. I guess we should start treating her for Wilson's.
That's what I do.
I will talk no more of books or the long war, but walk by the dry thorn until I have found some beggar sheltering from the wind, and there manage the talk until her name come round. If there be rags enough, he will know her name, and be well pleased remembering it. For in the old days, though she had young men's praise and old men's blame, among the poor both old and young gave her praise.
Hi, Mrs. Palmero. Ready to go home?
Almost.
Mom?
How are you?
I'm good.
Oh. Oh, you really need a haircut.
Dr. House. Luke, we're making Dr. House wait.
That's okay. We're just here for the music.
Luke, come on. I'm being discharged.
I heard a rumor.
Thank God I had cancer, huh? It's terrible having everybody think you're nuts.
Really?
I called to thank you. Did you get my message?
Yes. You're welcome.
Never thanking you. You turned me in. I told you we were doing okay. It was none of your business.
Look, I don't care how you were living.
I just wanted you out of my life.
That's why I had Dr. Cuddy call social services.
You okay?
You were right. It wasn't the DVT. It was the schizophrenia.
I know.
She's not nearly as interesting anymore.
Isn't it your birthday around now?
Carly, I was wondering, could you walk us through what you were thinking for other Asian territories?
Absolutely. India has over 500 million women. In terms of spending power, it's the single largest potential market in the world. We have retained a local firm to ensure that cultural differences are respected. However, I can't go into the specifics of my plan with you until tomorrow. Right now, I have a meeting and I need the room.
We were just getting started.
I know, and I do apologize. It's last minute, but the meeting is with 3 State Department officials to smooth the way for China.
China? This is just incredible.
We'll be in touch.
Thank you.
What is it? I need a doctor. I can't. can't move my leg.
Hold still, the x-ray machine is going to pass over your leg.
Okay.
What'd you do with your time off?
Snowboarding instead.
Switzerland.
Do you ski your board? You can come with if you like.
Maybe we should start with a drink before we go around the world.
Oh, you want to have a drink with me? Ooh, very aggressive. I like that.
Our initial tests say you're fine. We think you had a clot, but it resolved on its own. So we're gonna keep you overnight to be safe, and you can go back home tomorrow. Or back to work. Hey, you okay? Get in here! I need a line in her. IV morphine stack!
You guys see the problem here?
There's no indication of any abnormalities. No lesions, no spurs, no
Her
masses.
toes are screwed up. They're backwards. You guys know how much surgery it's gonna take to swap them back?
What are you talking about?
Well, either she literally has 2 left feet or you angioed the wrong leg.
That's impossible. It can't be.
Or maybe it was Jenny. How come some resident signed this radiology report? Were you even in the room?
I'll redo her angio straight
You'll
away.
do nothing! Foreman, you do the angiogram.
My chest hurts.
It's from the tracer I injected. Might also get a little nauseous or have a metallic taste. All normal.
I'm a runner. I shouldn't feel like this.
Carly, I'm looking at your vitals right now, and...
I can't breathe.
Carly?
My chest. My chest.
Respiratory arrest. Call code. What do you got? She's drowning.
Dr. House. I found a picture online of you at a conference.
You need a heart transplant.
I run, I work out.
You cut yourself. Probably highly ritualized. You play the same Sarah McLachlan song over and over while you do it. Probably works better than antidepressants.
I don't understand how that
You're a high-powered bulimic. You make yourself throw up. You had to find the most efficient way to vomit without revealing the telltale signs of bulimia, which is all very unseemly for a CEO. So you found a common antidote to accidental poisoning to do the job, Ipecac, which is great if your kids just swallowed a bottle of aspirin, but really, really bad if it's a habit. Causes muscle damage, caused the pain in your leg, and destroyed your heart. How often do you do it?
Three times a week.
In about an hour, there's going to be an emergency meeting of the transplant committee to discuss where you fall on a list should a new heart become available. Problem is, I am required to tell the committee about your bulimia. It's a major psychiatric condition. Ranks right up there with suicidal. Makes you a very bad risk.
So you're here to tell me I have just a few hours to live?
Unless I lie to the committee. But if they find out, I lose my medical license. This would be a very good time to offer me a bribe. You know, how much is your life worth? How much is my job worth?
Why are you here doing this to me? What do you want?
I want to know what's right.
Am I worth it? You think I'm pathetic. Has a good job, everything in the world, but she just doesn't like the way that she looks.
Stop hiding! I'm asking you if you want to live or die. You can't even say that.
What do you want me to do? Cry?
Yes! I want you to tell me that your life is important to you, because I don't know.
Because that's what's on the table right now. Your life.
I don't want to die. I don't.
Any psychiatric conditions, history of depression?
She's a little blue, but turns out she needs a heart transplant.
Dr. House, if you subvert or mislead this committee, you will be subject to disciplinary action.
Dr. Cuddy, do you have any reason to think that I would lie?
I simply want you to answer the question. Is there anything on the recipient exclusion criteria that would disqualify your patient from getting a heart?
No. Okay.
Hey.
I know the cardiologist is giving you some guidelines. Schedule of medication and a strict diet. Just what somebody with an eating disorder needs. So I thought I'd get you started. Fried chicken from the Carnegie Deli.
You're kidding.
Yeah, actually, I got it downstairs.
Why did you fight for me? You risked so much, and you hardly know me.
You're my patient. Don't screw it up.
By a length, the burning bush on the level has kept Andy right up on the inside, and Bobert results in a score off the base today. 5 or 6 away last.
Is anybody here a doctor? Trying to cop a field?
I took a CPR class at the Y.
Useful if she was having a heart attack instead of a seizure.
Seizure? Hold her tongue down?
If you want to get a finger bitten off, call an ambulance.
Methodist is 3 blocks down. I could drive her.
Just make the call.
What the hell is that?
How should I know? Tell the paramedics to take her to Princeton Plainsboro. Her doctor's name is House.
And it's Terminator winning by 2 lengths.
started to seize?
Spend as much time around the real people as I do. Someone gets sick.
Her platelets are 89, she's anemic, and she has a blood alcohol level of 0.13.
Hot OTB, babe? Obviously a working girl. Probably an STD, infection.
No fever, no infection.
Alcohol abuse explains it all. Causes seizures and affects her blood's ability to clot, which causes bruising. Start her on heparin, she'll be fine by morning.
Except for the fact that the bruises are not particular, which means it's not DIC.
So the bruises were caused by trauma. She probably got beat up by a boyfriend or a pimp.
What's that called when you judge someone before ever meeting them?
She's a regular at OTB. Somehow I don't see her holding down a 9 to 5 and going to PTA meetings.
I was there. I have a 9 to 3 job.
It could be SLE, familial telangiectasias, or even Cushing's.
Good. Start with those.
Which one?
Cushing's. Explains the seizure and the bruising.
Not the anemia.
So she doesn't need a lot of meat.
DIC brought on by alcohol abuse is far more likely. Do a full workup. H&P and Labora. LP, MRI.
Whoa! Did you just ever so subtly order me to get her medical history?
Cuddy put me in charge last week, so yeah.
The mass in the pancreas is benign. It's probably just scar tissue.
Good news. She's not sick at all, other than being an alcoholic.
The labs you sent yesterday put her ACTH at 64 picograms per milliliter. She's got Cushing's. Something set it off. It's got to be in her brain. Set her up for a venous sampling.
There is another possibility.
Chase, hold on.
How'd you get him trained so fast? Electronic collar? Got treats in your pocket?
She didn't even read the consent form for the pancreatic biopsy.
Who reads those things?
Maybe she didn't read it because she knew that there was nothing wrong with her. There is another explanation for the Cushing's. Maybe she injected herself with the ACTH. Her behavior suggests Munchausen's. She's had 4 hospitalizations in the last 4 months.
Well, being hospitalized a lot certainly points to nothing being wrong with you.
She's had 0 symptoms since she got here. The scarring on her pancreas could be caused from injecting herself with the benzene and setting off the seizures.
She's had brain surgery. You can fake a stomachache. You can't fake a brain tumor.
You can fake an invisible one. We should check her apartment. Look for medications, syringes.
Venous sampling's easier.
And more dangerous.
Not if you get caught breaking in.
So don't get caught. House.
There's even books in the bathroom.
Well, either she's very smart or she has a severe fiber deficiency.
She's got an appointment with her ophthalmologist on Tuesday and an appointment with her gynecologist on Thursday.
Multiple appointments with multiple doctors. Symptom of Munchausen's.
Or, just thinking outside the box here, she has a vagina and trouble reading. It's 3 pairs of reading glasses, each with different prescriptions, which would be explained by a tumor pressing on the optic nerve.
Because you're looking for her to have a tumor.
And you were looking for a person with Munchausen syndrome. Drinks battery acid, then go to an ophthalmologist to get their pupils dilated.
An ophthalmologist is a doctor. Attention is attention.
How many hospitals have you contacted? Has one doctor said she's crazy? It's not Munchausen's.
It's not your call.
Wait up. It's all right, she's gonna stay.
Wonderful.
Oh, bite me.
I don't need to hear the riot act again.
How'd you like another medical test?
What?
Sit.
Why?
So you don't crack your skull when you pass out. Just do it. You know what colchicine is?
No.
Well, don't feel bad. It's for gout. It's got nothing to do with anything you've ever pretended to have.
I'm not pretending.
Shut up. Colchicine decimates your white blood cells, leaves almost no trace. It's great for faking your way into hospitals.
I didn't fake my way.
Shut up. You've been doing this for years. Don't worry, it's probably not your fault. When you were a kid, you had a close relative who had a chronic disease, probably a sister. And you saw all the attention she got while you were left alone, ignored. And it really seriously screwed you up.
I do not have a relative.
Shut up! I'm trying to give you what you want. And save your life. You have aplastic anemia.
What are you trying to scare me now?
Means you're not just sick in the head. Problem is, the rest of you appear as well, so I gotta make you seem as sick as you're supposed to be by injecting you with a drug that simulates the symptoms that you actually have. All you need to know is, you've hit the Munchausen's jackpot. I'm gonna give you a cocktail of insulin for seizure and colchicine to kill your white count. This will absolutely confirm my diagnosis of aplastic anemia. There is one small catch. If you've actually done something to yourself to cause the anemia, then I'm wrong. And if I do what I plan to do, then the treatment will kill you instead of saving you. So I need to know, have you been taking anything besides the insulin, the ACTH, the pills Cameron left in your room?
No.
Good. Give me your arm.
It was my mom. She had MS. She was in and out of hospitals all the time. People were always trying to do things for her. Bring her food or brush her hair or make her happy. People cared. She died when I was 16. And there was no one.
Boo-hoo.
Where are you going?
Well, I obviously can't be around when it happens.
Well, what are you gonna do? You're just gonna...
Relax. You know the drill. People walk by here all the time. It'll be fine.
Oh, barely out the door and she has another seizure.
She must have somehow grabbed insulin on the way out.
When she's stable, we need to get her out of here before she does more damage to herself.
We can't. Her white count's down.
Sorry, I missed that. Hearing's been off since the Ricky Martin concert. Some cholo kicked me in the head.
White count, hematocrit, and platelets are all off. Her bone marrow is shutting down. She actually has aplastic anemia.
Say what?
All her other labs show nothing that would...
Labs, schmabs. A good diagnostician reads between the labs.
You were right.
Hey. We're not here to play the blame game. These things happen. Sometimes doctors send people out on the street to die after other doctors have warned them that they're sending people out on the street to die. There's no way you could know.
I'll go give her the news.
4-week-old infant submerged in a bathtub. Don't know how long. Non-responsive at the scene.
Got a trauma team for 6.
Obviously breathing now. Continue the blow by stat portable chest. Caucasian female, 32. Clonic seizure in the bathroom. What's on the scan?
Where am I?
1, 2, 3.
Where am I?
1, 2, 3.
You're in the hospital, honey. You're in the hospital. Honey, Mikey's here. And the doctors say he's gonna be okay.
Hopefully. He needs to be checked out by the NICU.
What happened?
He passed out.
What?
Mikey fell.
Has your wife had a seizure before?
No.
I can't move my head. I want to see him.
He's right here, honey. He's okay. He's right here.
How are you feeling? Okay. A little groggy. There's somebody here to see you.
Hey, Mikey. Mommy's awake.
Oh, Mikey. Oh, gosh, I was so scared. Oh. I love you so much. Oh. I'm sorry.
You don't have anything to be sorry about. You were sick.
Where's the baby?
breath sounds. Crash Sergeant M.D, stat!
Your son is stable, but the lack of oxygen damaged his kidneys.
She must have rolled over on him by mistake.
Mr. Mason, I was there. Your wife tried to smother your son.
That's impossible. Kara would never hurt Mikey.
He knows. They said Mikey knows. You hear voices? They wouldn't quit saying that Mikey would be better off if... They were right.
How do you feel?
My stomach kind of hurts.
I need to ask you some questions. See how you're doing. Tell me your name.
Cara Mason. Is my son here?
When were you born?
Please. Where's Michael? Is he okay?
Do you hear any other voices besides mine?
No. Answer me.
You've been suffering from delusions. They were caused by a vitamin deficiency, pellagra. It made you believe things that were not real.
Like the voices. I remember doing things to Mikey. Were those real?
I'm afraid so.
So
You tried to suffocate your son.
But you stopped me. And that other doctor, he got Mikey breathing.
His son's organs were damaged too severely. He passed away this morning.
Oh, no. Oh, my God, no. Oh, my God.
God of compassion, take Michael into your arms. Welcome him into paradise. There will be no sorrow, no weeping, and no pain. Peace and joy forevermore. I'm sorry.
How would a baby have flattened villi?
He was being treated with polystyrene.
Polystyrene shouldn't...
It didn't. The question is, what did they use in the NICU to bind it together?
Wheat gluten.
It's great stuff, unless your body can't tolerate it.
The baby didn't have colic, he had celiac disease?
Just like Mom. Celiac can be triggered by all kinds of stress. Bills, childbirth, drunk husband. Every time she had a bowl of pasta or a slice of bread or slosh of soy sauce, her small intestine became more damaged, less able to absorb the vitamins and minerals in her bloodstream. Her body couldn't absorb enough niacin, it caused the pellagra. Couldn't absorb vitamin K, it caused the bleeding. And celiac is why the baby's meds didn't work. His body just couldn't absorb them. Switch Mom to IV nutrition. It's gluten-free. It'll spruce her villi right up.
No, celiac causes nutritional deprivation. Our patient has excess calcium.
Tell him what causes excess calcium. With a chaser of bloody vomit.
Celiac patients are susceptible to cancer of the stomach lining. She has malt lymphoma.
Well, she's your patient now.
killed my son.
Is it my turn to say something obvious now? Oh, I know. You were insane.
I did it. I chose to do it.
Yeah, like diabetics choose to not produce insulin. Listen, someone got sick, someone died. It happens every day. The only difference in this case is it wasn't the same someone.
I could have stopped. I didn't have to listen to those voices.
Spoken like a true sane person. This is not your fault. You're healthy now. Except for the cancer.
Those voices felt as real to me as Michael's hand. Right here when he nursed. And the smell of his hair.
You do not deserve to die.
Maybe. I don't want to live.
If you got treatment, then maybe we could. When you see Mikey, tell him Dad says he's sorry.
Dr. House, this is Dr. Kelly Benedict, your new fellow.
Nice to meet you. I just finished my psychiatry residency at St. Jude's, and I loved studying the mind, but I thought it could make more of a difference, or at least...
Man, you're hot. I mean, seriously.
30-year-old female.
I know what you're thinking. She looks like Cameron, and he's hired her solely to sleep with her.
No, none of us were thinking.
Well, you should have, but you'd be foolishly wrong. Yes, he's been dating at a near Clooney pace recently. But at this point, the only hole he's trying to fill is the one in his soul, which means it's the emotional connection with Cameron that he misses. Did you ever marry a dying man, and if so, did you freeze his sperm?
Okay, so Cameron's his ex, but sperm...
She's not like Cameron.
Then why'd you make her wear Cameron's clothes?
No, I'm wearing my own
30-year-old female, severe vomiting and abdominal pain, preceded by 3 days of moderate pain, slightly elevated LFTs.
Could be lead poisoning.
If I know Dr. Shammerin, and I think I do, she'll want this chance for a little stuff strutting.
Okay, hepatitis A.
Serologies are negative.
Right, appendicitis.
It hasn't ruptured by now? It's hepatic fibrosis.
At the risk of having Foreman snark at me, too, lead poisoning could also work.
Liver angiogram to check for fibrosis. Search the home for heavy metals. What's your position on the legality of illegal break-ins?
That's more of a second week type activity. We'll do the angiogram. I'll meet you in radiology, 3rd floor. She was nervous. Give her a break. Oh. And she's not like Cameron.
True. Cameron had much smaller breasts. By which I mean she was smarter.
I'm not hiding anything. I just got the days wrong. I worked in Trenton on Tuesday. I worked in Summit on Monday. I guess it slipped my mind.
Breaking 8 ribs, that slipped your mind too?
You know, I was on the cycling team when I was at UMass. Well, during training, I fell off my bike right onto a sprinkler head.
Why didn't you tell us?
It was 10 years ago. I didn't think it could be related to my stomach problems.
We're gonna need to see the records from the operation.
You think it is
The
related?
strange stuff we found in your liver, it's probably hepatic fibrosis, but it could also just be a screw-up from the old surgery.
The operation was done at the University Hospital. Hopefully they still have the records.
I called UMass. There's no record of any surgery for Margaret.
You use her maiden name?
No, Kelly knows nothing about the concept of married names. It wasn't covered in her psychiatry residency.
Margaret was never even registered at the university.
Call the other hospitals in the area.
Done nothing. So I ran her social security number through one of those websites. Her number matches her name, but she's got no credit history until 3 years ago. And based on her number, she was born around 1945. She stole someone's identity.
Supraventricular tachycardia, 150 BPM.
You got a massage?
Not responding.
Get the adenosine.
Right already. Get the pacemaker. We can overdrive her.
Dorothy. Dorothy, dear. It's Aunt M, darling.
What's wrong with me?
Well, on the one hand, you've got some mysterious heart and tummy problems. On the other, you look great for a 65-year-old. So who are you? And no, that's not some weird Canadian pronunciation of how.
They're saying you changed your identity. What are they talking about, Margaret?
I don't know.
Well, it falls in the obviously stupid lie category, which you're familiar with from the one you told us about your bike accident. You thought we'd never check?
5 years ago, I was married.
Who was he?
Just a guy. I met him in high school. He was older. He used to get jealous. Do drugs.
Those broken bones?
He would tell me to take off all my clothes so he could inspect me. Then he would hit me. I got a restraining order, ran away, but he found me anyway. That's when he broke my ribs. So I moved away again to Arizona. Came back from work one day and he'd broken in, fed pesticides to my dog, killed her. I bought a dead woman's identity, changed my name, moved here.
Is this related to why you were in Trenton yesterday?
There's a support group for abused women at Trenton General. I go a lot.
What's his name?
Please don't do this.
Just tell me.
Carl.
Carl what?
This is why I didn't tell you. Because if you go confront him, he'll kill you.
Well, I got another name you can tell us instead. Yours.
It's Jenny.
Hey, baby. Hey, I'm not getting mad. I'm just trying to understand you here. If there's no meeting like you talked about at Trenton General, you see, it turns out that...
The turnout, it's been turned.
What?
It's turning.
Hey.
You're going to burn.
What's happening to her?
It's hit her brain, whatever it is.
Opacity in the left temporal lobe.
It could be nothing.
Get us nowhere. So let's assume it's something. What kind of something?
Abscess.
Or lymphoma or Wegener's. You'd have to biopsy it to be sure. Any of them could explain all of the symptoms.
You know, we're assuming everything is connected.
Because it probably is.
But her delusions are consistent with mental illness. Bipolar disease, for example. She's 30. It could be hitting her right now for the first time.
So her mind just happens to fall apart right after her body. Oh, I thought I was having a bad week.
I know it sounds coincidental.
You know what? I'm back to the Cameron theory. But you hired the dumb version of Cameron so that you could fire her and get revenge.
Give her a break.
Will you switch sides? Let me guess. Chase represents the dumb version of 13.
I realize if we all just keep pressuring Kelly, of course she's gonna get stuff wrong. It's irresponsible of me to let that happen.
You are a true leader of men. Get someone to cut into her head, give me a biopsy.
Still hallucinating.
Can you hear me? What are you looking at?
The table, it's on fire.
If it was, you think I'd be able to do this? Without screaming for my mommy?
Thank you.
Don't be too impressed. It's mostly the happy pills you put her on. She can talk to us now. The obviously stupid lie you told us about your hospital records turns out to have been unobviously unstupid. You thought you wouldn't get caught. Because you thought that you'd be cured and back home by the time we spoke to the other hospital. Because you knew what was wrong with you. Your doctor was treating you with risperidone, right? That's why you were in Trenton. You got the stomach pain, you went to see him, he wanted you to taper off.
Our doctor is not in Trenton.
Not the one you know about, if you haven't figured it out by now. Your wife has a secret.
What the hell's he talking about? It's about your ex?
The ex was not so much a secret, more of a lie. You weren't married before, were you?
I'm sorry, I didn't want you to know about it.
Know about what?
She's sick. She's been sick for years. Maybe put you on the streets. Maybe that's where you got the broken bones. She's only suffering from one condition. Everything else is side effects of the drug that was treating it. She stopped taking the drug, the side effects faded, but the underlying disease is still there. Why don't you tell your husband?
Billy, I'm schizophrenic.
Excuse me, waitress.
I'm afraid the teriyaki chicken's no longer on the menu.
Oh, I'm sorry. That's what you had last time. We've never been here before. I definitely remember you.
Oh, well, we never get up north. We're just up to see a friend of ours who moved here last summer.
Your hair was lighter. You had little round glasses.
Sounds like you.
Henry, don't play along. It's a gimmick for tips. Could we get some water?
It was last August, Saturday the 14th. You were wearing a blue dress with polka dots. Your eyes were puffy, like you'd been crying.
The 14th is Darren's birthday. He said he had to cancel his party because his old girlfriend showed up. They got into a huge fight.
Henry.
I knew it. Damn it. Ever since that ski trip when the two of you disappeared.
I'll go get your water.
Are you all right? Are you okay?
I can't move my legs.
I'm Elena, Nadia's older sister.
You don't have to be here.
But I'd like to pretend you'd visit me if I were in the hospital.
You brought daisies.
They're your favorite.
No, they're my least favorite. I was stung in the face 6 times, but...
What's wrong?
My heart.
Fast, wide, complex rhythm. Get the paddles.
Heart problems started when Nadia saw her sister. Stress-induced arrhythmia could be caused by long QT syndrome.
Her sister was barely in the room 5 minutes.
She said they've been estranged for over 6 years. It's a lot of tension.
Run a stress test to confirm long QT.
It'll have to be drug-induced. Treadmill will pull the stitches.
Drugs are never the answer. We want her heart to go crazy. There's something simpler and safer. Who's the sister?
You haven't seen each other in a while, huh? I heard the story about the time you hit Nadia with the car. It must have been pretty scary.
Why would you tell them that?
They asked about broken bones.
I swear that I checked my mirror.
You know that's a lie. You knew I was getting the mail and you just didn't care enough to check. Just like you didn't care that you ruined my 23rd birthday.
Nadia, don't start.
You started by coming here acting like you give a crap.
Here we go again. I'm such a monster because I brought daisies.
You need to leave right now.
What, is she gonna be okay?
Elena, get out!
Tell Nadia she doesn't need to worry about seeing me again.
I started the fight. We needed her heart rate to rise, so I provoked you.
You can't play with people like that.
Maybe if I explain to Nadia...
No, it doesn't matter. It's just one more fight for her to remember. I guess you're both bitches.
Smell her breath. Breathe out.
Pneumonia.
What is it?
I think your kidneys are shutting down. I didn't mean to make you hate her, and now that her kidneys have failed, I've always been a book and equations person. People are problematic and random and messy. And with sisters, I mean, I had a cousin who I was close to, and when our menstrual cycles synced, it was like gladiator
Do you
school.
want me to donate a kidney to my sister?
Yes.
Okay.
Really? It might not fix your relationship. Probably shouldn't have said that.
We found a donor. It's your sister. Just thought you should know.
Thank you for saving my life.
I love you, you know.
I was thinking about those times we went up to Spofford Lake in the summer. Whenever we took out the canoe, you'd tie up my life vest for me. In the afternoons, sneak me into the lodge so we could steal popsicles.
Maybe we could go back. I could drive us up there, we could get a cabin, and maybe rent a canoe. Oh, wow, I haven't thought of Spofford. And Nadia, you okay?
Elena, I'm sorry. I can't do this.
Can you stop? Just stop pushing me for a minute.
I understand now why you stuck yourself in that diner, away from friends, away from family. You can't forgive anyone. I don't think you weigh anything. I think you're like a lot of people. You focus on the bad memories instead of the good.
I don't have a choice.
Nadia, put your hand in your lap for a moment.
I'm not doing that.
I know. It's an involuntary movement called chorea.
What does it mean?
It means you still don't know what's wrong with you.
Come on. The woman has all the information we need.
She's a bottomless diagnostic library.
Maybe we're missing something from the apartment. Some lifestyle thing.
Yeah, it's all muscle strain from doing her hundreds of jigsaw puzzles.
We should do another MRI, a brain hemorrhage.
Hey. How many puzzles?
Okay, I was exaggerating. Dozens.
Do a peripheral blood smear. Look for acanthocytes. I'll be right in. Remember me? Just kidding. So, jigsaw puzzles.
I find them calming.
You ever left one unfinished?
No, that would drive me crazy.
Speaking of,
Why are you doing that?
more important question is, why are you?
It's just a habit.
It's a habit that compels you in an obsessive way. It's so bad, it's a disorder.
I don't have OCD.
Each brain with OCD has its own way of filtering it. Some people wash their hands and hoard TV guides. You do puzzles and hoard memories.
To what we thought was a gift. It's just you literally obsessing over your own life.
That's why I can't stop the memories even when I try.
But everything else? My kidneys.
Memory was a symptom of a larger disease. You have McLeod syndrome. It's a rare genetic disorder that affects the nervous system, blood, and can cause OCD.
Am I gonna die?
It can't be cured, but your various symptoms can be managed with medication. Best case scenario, you can live another 20 years.
If it's any solace, everybody dies alone. Probably isn't.
You said you didn't have a choice to be the way you are. Now you do. These are SSRIs. They've been effective in treating OCD.
You mean lose my memory?
Not lose it entirely. It'll just become more like anyone else's.
My memory is the only thing that has ever made me special.
Maybe so. But if you want to be special, you're gonna have to be alone.
How did it fight loneliness? Smile.